Welcome back. Talk about your healthy living. Allergists often get the question, when do I use the EpiPen or Benadryl for an allergic reaction? Both Benadryl and EpiPens are used to treat allergic reactions, but one is not a substitute for the other. This is what doctors are saying, guys, and they say that these work in very different ways. So we have our own doctor here to explain what we need to know. We want to welcome back Dr. Reena Mehta from Uptown Allergy and Asthma. Thanks so much for being here.
Good morning. Thank you for having me.
Absolutely. So if you are already an allergy patient, then you will have the question of EpiPen or Benadryl. If you're not going to have an EpiPen. That's a prescribed product, right?
That is correct. That is correct. So this is a common question I get from patients, from parents, kids who have food allergies. When do I use Benadryl and when do I use an EpiPen?
Okay.
So to your point, one is not a substitute for another. And so when I think about using Benadryl, it's when you're having very mild symptoms.
Okay.
Maybe it's like hay fever type symptoms, like a runny nose or an upper respiratory infection. Or if you're maybe itchy, you have a few hives, that would be a reason to use Benadryl.
Got it.
Reasons to use an EpiPen is typically what we say is 2 organ systems involved. So hives, throat closing, hives, vomiting, wheezing, vomiting, things like that. And so the biggest thing that allergists like to promote is that you never want to delay use of an EpiPen. The bad outcomes come when you don't use your EpiPen quickly and emergently.
And so a bad outcome, an example would be like anaphylactic shock, for example?
Absolutely.
Okay. Is that the worst it can get in an allergic reaction there?
Well, you know, you hear a few stories of these bad outcomes happening. Death is a possibility. If you don't intervene quickly, you know, anaphylactic shock can lead to death.
What about Benadryl as a preventative measure? Like, you know that your child is going to school or you're going to be in a situation where you might be exposed to allergens. Is that a good thought, or still don't use one for the other? Bring your pen with you.
Well, so depends what the allergen is, number one. You know, if it's something like pollen, then we might say, okay, take an antihistamine. If it's something where you know that your kid is very allergic to peanuts and they're gonna be in a setting where there's lots of peanuts, then you might decide to be more preventative and definitely bring your EpiPen. Now, I will say, a lot of allergists won't recommend Benadryl regularly because you can use something more like Zyrtec.
Okay.
Benadryl causes drowsiness, and it's quick acting, but it's not very long acting. So in an emergency situation, it is also okay to use Benadryl interchangeably Zyrtec interchangeably with the Benadryl.
And finally, when does one learn, and what do you recommend as a symptom to say, this is when I go get allergy tested?
Well, if you have any sort of a reaction that's unusual, so if you eat a food and within less than an hour you feel something, your lips are swollen, your throat is tight, you break out in hives, that is absolutely a reason to go get tested. If you suffer from environmental allergies where every time of the year you're suffering, where your eyes are itchy, your nose is watering, and it's affecting your quality of life, those are definitely reasons to go see an allergist.
What about allergy shots? Or do you believe that they are effective, and who is most likely to benefit from those?
Absolutely. Allergy shots can be a game changer. And so basically the concept of allergy shots is desensitization. We're taking the things that you're allergic to and helping you build a tolerance over time. So people who would be a good candidate are patients who suffer from regular allergy symptoms on a daily, take allergy medicine on a regular basis, get asthma issues, sinus issues from their allergies. They might have a pet that they're allergic to. 90 to 95% efficacy when it comes to allergy shots. We also have ways to desensitize to foods as well. We call it oral immunotherapy. So if your child has a peanut allergy, a sesame allergy, an egg allergy, you should talk to your allergist about ways to get desensitized, because that is an option as well when it comes to food allergy.
I love that word and that thought, desensitized. That is really such an important key in how we approach our babies. Yeah. Dr. Mehta.